Blood vessels, pulmonary circuit, pulmonary trunk, left pulmonary artery, right pulmonary artery, pulmonary veins, left superior pulmonary vein, left right pulmonary vein, right superior pulmonary vein, right inferior pulmonary vein, cerebral arterial circle and cerebral circuit. So here we have the common carotid artery and the bifurcation of the internal and external carotid artery. The external carotid artery gives off the superficial temporal, facial, and occipital branches. The two vertebral arteries come together to form the basilar artery. Here's your posterior communicating arteries, internal carotids, and your anterior communicating arteries of the cerebral arterial circle. The veins include the superior sagittal sinus, straight sinus, and the confluence of sinuses. Internal jugular vein, superficial temporal vein giving rise to the external jugular vein here. Medial to the jugulars, you have the brachiocephalic veins. Lateral to the jugulars, you have the subclavian veins. And then after the first rib, you have the axillary vein. Then for venipuncture, we have the cephalic vein, basilic vein, and median cubital vein. Inferior vena cava, superior mesenteric vein, inferior mesenteric vein, splenic vein, all coming together to form the hepatic portal vein. And then these are the hepatic veins: renal vein, gonadal vein, common iliac vein, internal iliac vein, external iliac vein, and then at the inguinal canal, you see that we cross to the femoral vein, and the femoral vein gives rise to the great saphenous vein. And then here we have the small saphenous vein. Systemic arteries include, you've got your ascending aorta, and the only branches off here are your left and right main coronary arteries. Then you have your aortic arch with your brachiocephalic trunk, left common carotid, and left subclavian arteries. As we cross the first rib, it becomes the axillary artery. Then once we're down here in the arm, it is the brachial artery. Now you have the superficial palmar arch, ulnar artery, radial artery. Coming down, now that we're distal to the diaphragm, you have the celiac trunk with your splenic artery. And here you have your common hepatic artery, superior mesenteric artery, inferior mesenteric artery, renal arteries, gonadal arteries, common iliac arteries, internal iliac, external iliac, as we cross the inguinal canal, femoral artery, popliteal artery, posterior tibial artery, anterior tibial artery, dorsalis pedis.